Fink and Hunt in Clinical Practice in Respiratory Care describe the two most commonly used devices in this category as follows. A humidifier is a device that adds molecular water to gas, whereas a nebulizer produces an aerosol or suspension of particles in gas. Bubble humidifiers use the bubble-through humidification process to bring dry oxygen gas to ambient levels of humidity. The gas is directed into the water bottle where it is broken up into small bubbles. These gain humidity as they rise to the surface of the water. The absolute humidity of the gas varies with flow rate, water temperature, bottle size, and volume of water in the bottle. Bubble humidifiers are most commonly used with low-flow devices such as nasal cannulae and medium concentration oxygen masks. Some models incorporate a pressure relief valve designed to prevent excessive pressures building up in the bottle should the oxygen tubing become occluded. Operation of the relief valve may also activate an audible warning, drawing the attention of the user to this problem. The flow meter should be attached to an appropriate oxygen supply. Fill the bottle with sterile water using an aseptic technique and fit to the humidifier head. The humidifier should then be attached to the flow meter. To test the pressure relief valve, adjust the flow meter to 4 litres per minute and occlude the outlet. Verify that the relief valve operates within 5 seconds. Reset the oxygen flow meter to the appropriate flow for the patient. Attach the oxygen tubing to the bubble humidifier and the delivery device and fit to the patient. The other method of delivering cold humidification is by using a humidifier nebulizer. Humidifier nebulizers use the Venturi principle to create a low pressure area at the end of a tube. The other end of the tube extends into a bottle containing sterile water. Water is drawn up the tube and is broken into an aerosol of small droplets by the oxygen stream. This same low pressure area also entrains air from the atmosphere to dilute the oxygen to the desired level. The air-oxygen mixture containing the water droplets then passes to the patient. Humidifier nebulizers are most commonly used with devices such as aerosol and tracheostomy masks. It is important that these devices operate as quietly as possible to ensure a comfortable environment for the patient. They should also conform to the international standards to ensure that the oxygen concentrations are delivered accurately. Some devices, for example the Aquamist, are fitted with a tamper-proof control to prevent inadvertent changes to oxygen concentrations. The head of the Aquamist nebulizer humidifier incorporates a universal screw thread. This permits the use of a bottle which can be refilled with sterile water or the use of some pre-filled sterile water bottles. The flow meter should be attached to an appropriate oxygen supply. Fill the bottle with sterile water using an aseptic technique and fit to the humidifier head. The humidifier nebulizer should then be attached to the flow meter. Attach 22mm flex tube to the outlet of the humidifier nebulizer. It is important to position the tubing so that the lowest point is below the patient and to regularly drain any condensate to prevent any condensed water from running into the patient or occluding the flex tube. Attach the aerosol mask and then adjust the oxygen concentration to the required level. Set the flow meter to provide the required total flow to the patient. The intersurgical Aquamist makes this simple by indicating the appropriate flow above each oxygen setting. Then fit the delivery device to the patient. An aerosol mask should be placed over the patient's nose and mouth, and the elastic is adjusted to give a secure and comfortable fit. When using a tracheostomy mask, the mask is positioned over the patient's tracheostomy site and secured in place using an adjustable elastic strap around the patient's neck. There is no international standard for flow meter connections, and they can vary by country and manufacturer. The Aquaflow and Aquamist both incorporate a DISS oxygen connection, which is the most common type. Flow meter adapters are available to fit other types of flow meter, for example the M12. These devices should not be used in ventilator circuits, as the air entrainment port will introduce a leak into the system. These devices should also only be filled with sterile fluids